Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gaulin.
Hey everyone, welcome to the Gastro Girl podcast. We're so excited about this episode because we're finally able to answer the question that most of you have for us. We get emails, we get messages. How do I live well with IBS? And this is perfect timing because I have on this episode two of my favorite experts. We're so excited. We have the world-renowned Kate Scarlatta, a registered dietitian with amazing GI and digestive health expertise, and the prominent GI psychologist, Megan Reel, who has so much great information for us about the relationship between our gut and our brain. They just dropped, get this, ladies and gentlemen, this book called Mind Your Gut, the science-based whole body guide to living well with IBS. So this is perfect timing to have them on the show. Welcome, ladies, and congratulations on your book.
Thank you so much. Thank you, Jackie. We're excited.
So this is, huge. And I think what's so powerful about this is the collaboration between Kate and Megan. I mean, we have a GI psychologist and a registered dietitian. First of all, what led to you collaborating on the book?
Well, I think that I may have stalked Kate in an elevator one time and brought the idea forward to her, thinking that, she's such a powerful force in the nutrition space with patients that are living with gastrointestinal conditions, especially IBS. And as I was going about my day-to-day practice, teaching patients different skills and strategies where really they're not rocket science. It's helping patients to understand that, there are ways that we can really focus on strategies to improve our overall health, which has a profound impact on our digestive health. And I thought, what if we partnered? I can share some of my expertise in terms of behavioral strategies, and I certainly am not the expert in the nutrition space, but that's such an important part of people feeling well and when they live with IBS. And so who better to partner with than Kate Scarlatta?
Geez, I love that. And, when Dr. Reel came to me and kind of pitched this idea, I thought, wow, there's really not a book out there that combines the nutrition with gut-brain-directed therapies. There's either gut-brain-directed therapy books or there's nutrition books. And, patients often require a dream team approach to managing. We know that a dream team approach is better for patients, better efficacy, better quality of life living with IBS. So it was a no-brainer, and it's been a fun journey working with Dr. Reel. She's a very brilliant and also very relaxing partner to work with. So it's been a lot of fun. I've learned a lot along the way, but I'm really excited about this book because I do think it's going to be a game changer in IBS.
Oh, absolutely. So set the stage for us. How many people are affected by IBS?
Well, 45 million Americans are affected by IBS, but I think what's really fascinating about that is, 1 in 5 people that have IBS haven't talked with a medical provider about their symptoms. And so, what this book will allow us to do is hopefully people that have been struggling that, they might go to Dr. Google, and hopefully our book rises to the top. And that way they're getting science-based information about their diagnosis. And we provide an overview to help people understand the diagnosis of IBS and that it's complex and that everybody's pathway to a diagnosis of IBS is typically very different. And then we dive into, things that they can try, but also giving them information about, what medical workups they should have, what they should be talking about with their doctor. Maybe they try some of Kate's low FODMAP gentle approaches, but maybe they need more instruction with an actual, live GI dietitian, and we give them the pathway forward for that. Same with the GI psychologist. So, there's a huge number of people that are affected with IBS that, we have in our research. But as most researchers and gastroenterologists will say, is that number is probably underestimating how many people are actually affected with IBS.
So for those who may not know, what is IBS?
So IBS is a, chronic condition. It's a GI condition that presents with abdominal pain. So that's really the major characteristic. Pain is present and is associated with alteration in bowel habits. So some patients will be more constipation predominant, others will be diarrhea, others might have a mixed presentation where it goes from constipation to diarrhea. But it's diagnosed based on this symptom presentation. So there's no biomarkers specific for IBS at this time. But, as Megan said, it is really a debilitating, life-altering condition that can be embarrassing for people to talk about, so they often don't. And so we're hopeful that this book provides really good, solid science for them to go read about it and then be empowered to talk more with their physician about their symptoms.
Yeah, it's alarming when I hear 1 in 5 aren't even getting treated. That's pretty scary. And I have IBS myself, and it can be, for me, it's stress induced. And it can be miserable sometimes because you just don't feel yourself. So we want tools to help us better understand. So what does your book do for patients? Like when someone gets a diagnosis, you have IBS, it's like, oh my God, now what? And how can your book help them?
Well, I think, we really go through sort of the stressors that may be the instigators. Like you mentioned, your IBS is more stress-induced, and then others are more diet-induced. And some people have a little bit of both. And so, Megan really runs through various behavioral approaches with science that are backed in science that show an individual, we address, does this sound like you? We give some scenarios. And then maybe these approaches, whether it's diaphragmatic breathing or seeking someone that is knowledgeable in gut-directed hypnosis, a variety of different treatments. And then we walk through different dietary interventions, reminding the reader that GI conditions are associated with an increased risk of eating disorders. So we want to make sure that they're appropriate for a diet intervention for starters, and then walk them through a variety of different approaches, whether it's a more gentle, what we call bottom-up approach, where we're cherry-picking out certain foods that might be problematic, or going full range into elimination diet, and how they can kind of read through and decipher, maybe diet's not for me, and I should look more at those behavioral guidelines. And of course, we encourage them to work with health professionals. This is not a substitute for their doctor, but we can provide them guidance on which types of therapies might be most appropriate for them based on their lived experience with this condition.
What I think is so important is that it is all evidence and science driven. We're inundated as patients, as consumers, with social media, with, pretty girls on social media saying, I reduced my bloating and I did this and I don't have IBS anymore. And it's so overwhelming that I think this book can really serve an important purpose in kind of guiding patients to the right care and the right science-backed interventions that are not going to do them harm, is what it seems so important. Megan, would you agree about that?
Yeah, we've really been careful to highlight the science. But I'll use probiotics as an example. So we know that, ACGA guidelines don't necessarily support the use of probiotics as gold standard treatment. But we know that gastroenterologists are using probiotics, and we know our patients are buying probiotics. So I'll use that just as a simple example that we don't say don't use probiotics, but we give guidelines on if you've been using a probiotic for, let's say, a month or two, and you notice no improvement in your symptoms, that the intervention that you're using is not giving you the quality of life that you're looking for, then stop that probiotic. And maybe we also give instruction, then maybe try a different strain. We highlight 3 different probiotics that do have some science attached to them. But we really help patients to recognize that sometimes it can feel anxiety-provoking to stop something that maybe you thought was going to be the thing that helped your symptoms. But knowing that there are so many other options out there, there are other tools and strategies, whether it be diet or behavioral interventions or maybe it means you go back and have a deeper conversation with your doctor. We really give people kind of a roadmap for how to navigate some of the nuances of this diagnosis. And our overall goal is to help people feel hopeful about this diagnosis and empower them that, while there isn't a cure to IBS, when you have the right toolbox and strategies in place, the severity of your symptoms, the frequency of your symptoms, the duration of your symptoms can improve. And therefore, when you do get a little gurgle or stomach upset or you've gone to the bathroom, that's not causing significant anxiety anymore. It's more of, hey, I know what to do. I'm going to go back to mind your gut and really review those strategies that have been helpful for me.
That's great. So how, Kate, what would you say to patients who are, thinking about getting your book? Like, what can they expect to get from this book and understanding the relationship between the gut and the brain and how not only dietary interventions, but the psychological interventions can help?
Well, we really go through behavioral interventions pretty significantly in the book. It's the first chapters. So we really, I think it's a little bit more novel to really understand some of these brain-gut therapies and understanding that connection. So the reader's going to read right into that initially and find themselves in Megan's words, like, yeah, this is me. Oh my gosh, this is me. And then identify, okay, what next? And we provide them the resources to either get in touch with a GI psychologist or work with even some digital apps that might be appropriate for them if they don't have access to a GI psychologist in their area. From the nutritional standpoint, again, we really kind of harbor through like, does eating cause symptoms? Well, it does in the majority of, 9 out of 10 patients experience eating-related symptoms. So, where do they fall in that sort of intervention list? Do we need to bring them right into a low FODMAP elimination diet? Is that where they belong? Kind of really walk them through that, again, so they can really identify where they may need to start, and then, again, where to get resources to help guide them, because a lot of the nutrition interventions for IBS are, they're nuanced and confusing, and, we do outline it. So if they don't have access, they have a barometer on how to do some of these interventions, but, they have a starting point to see where they should go or where they shouldn't go, again, because of disordered eating risk, maybe slide back to the behavioral therapies and move away from the nutrition therapies, et cetera. But really, we walk them through it 90,000 words later in this book. It's very comprehensive. And I will just say a couple things here. You had mentioned just about, all the misinformation. We call out snake oil in this book really clearly. Yeah. So there's a lot of like, hey, there is no such thing as leaky gut syndrome. Let's talk about that. There's no protocols. I think common things that you would see on TikTok, we kind of call out and say, step back. This is not real.
Yeah. And it's crazy because when you click on something and you listen to it, then you're inundated with more. I've never seen so many drinks that are supposed to reduce bloating, gas, and constipation than ever before. I'm like, oh my God, and it's overwhelming for patients. Totally overwhelming.
I think, it sets them up for expectations that are not real, right? So we can't cure IBS. Anything that's out there that's saying that they can cure IBS is really, again, going to make most people feel bad because, we're all prone to a bout of, the stomach flu. And so again, we want people to know that it's more about reducing the anxiety about how you're going to manage and that you can go a long time between bouts of symptoms. And also you can go from, every time you have symptoms, it's severe to, when and if I have symptoms, it's more mild because I have these resources. And, we were really strategic in how we set up the chapters of the book, like Kate said, because we are all prone and experiencing stress, no matter what. So, anyone that is reading, the first couple of chapters and learning how to do diaphragmatic breathing or a muscle relaxation strategy, you're going to benefit. And that's where, some of my colleagues that have had their chance to review the book that specialize in things outside of IBS are saying, really anybody with a digestive health condition could benefit from this book. So our colleagues that specialize in inflammatory bowel disease are recommending that their patients consider this as a supplement. It's obviously they're two very different diagnoses, and inflammatory bowel disease requires, very careful medical management. But anybody with IBD also, can benefit from the behavioral strategies, and then also just kind of thinking about their nutrition and some healthy ways that we can approach having as liberal of a diet that works for each individual.
So, so let's talk about how can I live well with IBS? Let's get some tips for patients within, your book. How can we live well with IBS? What are your tips? Kate, do you want to go first?
Sure. So I think there's a lot of lifestyle tips in general that will benefit patients and really everyone. Again, like Megan said, a lot of the tips we recommend are just for everyone. So adequate sleep, 7 to 9 hours, getting a walk in, especially nature walks are really grounding to be in a forest bathing. So getting out there and moving your body also is really good for motility. So if you're prone to constipation, eating balanced meals. I know it sounds like rocket science, but people leave the house with a bagel and walk out the door. There's no protein, there's no produce, there's no healthy fats. They get their dry bagel and they're running out the door. Or they're doing some crazy chia cleanse that they learned on TikTok. So balanced meals, eating regular meal times, not just like skipping all day to avoid symptoms and then coming home and chowing, which is really just too much overload to the intestine. It's going to prompt symptoms the minute you wake up, and then you go back into that cycle. So there's a lot of lifestyle things. And then from a nutritional standpoint, it's just really looking at your diet and recognizing, wow, all these FODMAPs are the foods that are problematic. Maybe the FODMAP gentle or FODMAP elimination diet is more for me. Or maybe I'm looking at, we talk about the gentle diet cleanup. Maybe I'm just downing a lot of alcohol. The pandemic really amped a lot of alcohol intake, and alcohol is a GI irritant. It causes a lot of water secretion into the gut, causes diarrhea when it's overconsumed. Sometimes people just need to clean up their act on their indulgences and not go down the path of a major elimination diet. So the most liberal diet is what we're going for, and we remind the reader of that. We want them to have a good quality of life around their eating habits, but it's going to be different for different people because their needs, their gut microbiome, how they got IBS, whether it's a post-infectious episode or long-term childhood IBS diagnosis, those all factor in. It's not a one-size-fits-all, so we really kind of hone into that. But there are definitely some things that can help all of us with IBS or not.
And Megan, what are your tips that you want to highlight from the book?
Yeah. So one thing that definitely comes to mind again that works for anyone, regardless of whether they have IBS or not, is proper pooping position. So, we were very thoughtful and put a lot of creativity into the figures and pictures that are in this book. So we have a beautiful illustration of proper pooping position to help remind people that, elevating your knees above your hips, leaning forward at about a 35-degree angle with a very straight spine, that technique alone. I just had a patient this week that was like, hey, you mentioned that last week. I now am trying that. And oh my gosh, how come nobody ever told me how to properly poop? And, and so that's something that we've been talking about that, yes, as an adult, you're going to be the one that picks up this book, but we can talk about it with our families, teaching our children at young ages that number one, we should be pooping regularly because we work with a lot of adults that have constipation and, they get to their 30s, 40s, 50s, and that's when they recognize that going to the bathroom every 7 days or 10 days is not normal. And so, if you as an adult are making some adjustments in your pooping and you've never talked to your kid about, hey, what do you do when you're on the potty? It can open up some of these conversations. Talking also more globally about how our digestive health can impact the family. We talk about, how do we talk about food at the dinner table? And also including our children in having, a wide variety of healthy, nutritious fruits and vegetables on the plate. So we get people thinking outside of themselves too, that yes, we want you to be as healthy as possible, living well with your IBS, but it might spark some conversations with family and friends and loved ones about their digestive health and about some of the ways that we view our health and our nutrition and our lifestyle that may have a profound impact on your overall, family well-being.
Thank you so much. Well, ladies, this has been I can't wait to read the book myself. I can't wait to dive into it. There's so many good tips and information, science-backed, that is just so exciting. We have another thing that you guys recently released was your amazing podcast. Is it the Gut Health Podcast?
Yes, it is.
Correct. Available on all your favorite podcasting platforms. Super excited about that. And we have an exciting virtual book club event. If you purchase your book through the Amazon link shown in the description, you will receive an invitation to a special webinar featuring Dr. Real and Kate Scarlatta, RD. You can ask your questions live. It'll be so exciting and a really great event. So we'll put more information, but we're looking forward to seeing all of you on that live webinar event. It's going to be April 2nd. At 7 p.m. It's free. All you need to do is purchase the book and send us an email with your receipt, and you will receive an invite to that. Ladies, thank you so much for joining me today. Congratulations on your book. I see that it's number 1 on Amazon for newly released books in digestive health. That's impressive. I hope to see it on the New York Times bestseller list, which I have a feeling it will make. And so proud of both of you. Thank you for joining me today, and all the best.
Thank you so
See
much,
you April
Jackie.
2nd.
Thank you.
Thank you.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.